Hello, my name is Dr. Claire Smith and I'm the Program Manager of the Medical Radiations Program here at RMIT University. Today I'm going to talk to you a little bit about the three streams of medical radiations that you can study with us at RMIT, and then my colleague Catherine Baverstock will talk about our pharmacy program. These programs are world-renowned and allow our students to work across a variety of disciplines to replicate the real-world experience they will need once they start their careers. During this presentation, there are moderators available to answer any questions that you have. Whilst you won't be able to speak to ask your questions, please type in the chat function your questions and we will get back to you. I just ask that before you add a question, have a look through and see if it's already there. If that question has already been asked, just give it a thumbs up and we will try and tackle some of these questions live at the end of the session. Okay, next slide. Before I start, RMIT University acknowledges the people of the Wurrung and Boonwurrung language groups of the Eastern Kulin Nation on whose unceded lands we conduct the business of the university. RMIT University respectfully acknowledges their ancestors and elders, past and present. RMIT also acknowledges the traditional custodians and their ancestors of the lands and waters across Australia where we conduct our business. Next slide, please. RMIT is committed to redefining its relationships in working with and supporting Aboriginal and Torres Strait Islander self-determination. The university's goal is to achieve lasting transformation by maturing its values, culture, policy and structures in a way that embeds reconciliation in everything we do. In line with the principles of Bunjil, we are changing our ways of knowing, working and being to support sustainable reconciliation and activate a relationship between Indigenous and non-Indigenous staff, students and our community. Next slide, please. So I'll begin a presentation about medical radiations. As I said, I'm Claire. Next slide, please. So with us at RMIT University, you can do the Bachelor of Applied Science Medical Radiation. And RMIT is the only university in Victoria that offers all three medical radiation professions, that is medical imaging, nuclear medicine and radiation therapy. And this allows us to provide greater interprofessional education and increased knowledge of the other streams and a more holistic understanding of the patient and their journey. So like I said, we offer the three and we are the only university in Victoria to offer nuclear medicine and one of four of the universities in Australia. And depending on your specialisation, you will choose a stream either in medical imaging, nuclear medicine or radiation therapy. Next slide, please. So I'll look at the three streams and give you a bit of an understanding of what they are. So firstly, looking at medical imaging. So radiographers or medical imaging technologists assist in the diagnosis and management of patients via different methods of acquiring medical images through things such as X-rays, MRI and CT. Their role is to create optimal images of the body structure and to obtain data for the diagnosis and treatment of disease and injury. Next slide, please. In nuclear medicine, it is a type of medical imaging that acquires medical images about organ functioning using radiopharmaceuticals. It has a radioisotope and a pharmaceutical component that allows specific uptake in areas for imaging. Nuclear medicine technologists also treat patients using radioisotopes. Next slide, please. In radiation therapy, you design and implement the use of high energy radiation treatment for people who are diagnosed with cancer and other pathological conditions, typically with a LINAC, a linear accelerator. Radiation therapists promote care and well-being in the patients that they treat. All right, next slide, please. So for the Bachelor of Applied Science Medical Radiations, the ATR scores are shown, and these are from last year, but they give you a general idea of the requirements. You'll also see the units 1 and 2 and 3 and 4 in biology and chemistry, as well as the maths requirements. If you are successful in obtaining a placement, there is also professional compliance and immunisation compliance requirements, which you can find on our degree page for the program, which is also under BP 321. Next slide, thank you. So if we're looking at the medical imaging stream, you can see that this is what our students will study over the 4 years of the program. And you'll notice in their first year, they do a mixture of physics, as well as introduction to human biosciences, as well as limb and trunk anatomy. And this is where the MI group differ. So they'll focus on limb and trunk anatomy, as well as their core subjects related to the profession, which is the medical imaging 1 and 2, which they complete first and second semester. They also undertake foundations of professional practice and research in health science. Each subsequent year, they build on those foundations and advance the understanding and requirements of their profession and the technologies that they are using. In year 3, this culminates in the advanced imaging applications 1 and 2, where they learn about more advanced imaging, such as MRI, sonography, and CT. In their 4th and final year, our students do a 22-week placement and complete a research project as part of that final year. Now, if we go to the next slide, please. So here we have our nuclear medicine stream, and you'll see that it's very similar what they are learning. However, they learn specific requirements in the first year in the semester 1 and 2 for the nuclear medicine 1 and 2 units of the first year of the program. As well, they undertake the systems physiology in their first year second semester. Again, throughout the program, their knowledge is reinforced and provides a basis for ongoing learning and advancement in the areas they are studying, culminating in that 4th year where they go on their supervised and transition practice, which is 22 weeks of placement. Next slide, please. So here we have our radiation therapy stream. They're very similar structure, however, they have specific courses in the radiation therapy 1 and radiation therapy 2. And you can see moving through the 2nd to 4th year, there is the practice courses, which is for each stream. So in these practice courses, this is when our students are actually out on wheel placement. So as part of the course, they complete their work integrated learning and go out to a clinical site. And you can see they too end with the 4th year program and 22 weeks of clinical placement. Okay, next slide. So at RMIT, we're very fortunate to have state-of-the-art imaging facilities that was recently refurbished. We have functional X-ray tables and human phantoms that really allowed our students to have that hands-on and recreate the clinical experience. In our radiation therapy, we have the virtual reality equipment, including a virtual LINAC, the linear accelerator, which again allows our students to manipulate a LINAC as they would in real life and implement their treatment plans. In nuclear medicine, we have the hot and cold laboratories, hot being radiation and cold non-radiation, as well as equipment and pharmaceuticals that they would use in the real world in clinic, which allows our students to have that true hands-on experience so they are truly prepared when they go out to their placements and on completion of the degree. Next slide, please. So when you complete the program, you graduate in either the public or private sector as a nuclear medicine technologist, a radiation therapist, or a diagnostic radiographer. And next slide, please. At RMIT, in our program, we're very fortunate to have a close relationship with our students. We generally know them all very well, and I think this, in the statement given by Chelsea, we do provide a friendly and nurturing environment and hopefully academically motivated that will allow our students to succeed. All right, next slide, please. At RMIT, in the Medical Radiations program, we have strong industry ties with many Victorian interstate hospitals and our clinical sites, where our students do complete their will placements, as well as tertiary teaching hospitals and research centres. We also have strong connections to our professional bodies through involvement in staff membership, which includes the ANZ S&M and the ASMERT. As well, we have links to the federal government, which includes our PANSA, the Australian Radiation and Protection and Nuclear Safety Agency, as well as radiopharmaceutical companies and suppliers. We also have involvement with ANSTO via the Australian synchrotron and various vendors, which include Agfa and Siemens and Varian. And we also have these links with our advisory committees. Next slide, please. Currently at RMIT, we have a clinical education program using PET radiopharmaceuticals, which we're quite proud of in our nuclear medicine stream, which is in development. As well, we have connections with our PANSA and the synchrotron, where one of our HDR, high degree by research students, is completing some work with the Australian synchrotron. And I will now hand over to my colleague, Catherine Baverstock, and I hope that provides a good overview of medical radiations. Thank you.
Thank you, Claire. My name is Catherine Baverstock and I am the Program Manager for the Pharmacy Program. I've been at RMIT since the program began in 2011. And so today I'm going to talk to you about the program, how it's structured, what the entry requirements are, and what you could expect to do as a pharmacist when you graduate. And that's Danica. Danica is one of our fourth year students in our model pharmacy. Next slide, Nori. So this is the first step for you to become a pharmacist. After you've done your 4 years with us, you actually need to do an internship, and that can be in either a community or a hospital pharmacist. And once you've done your internship and your intern training program and your exams at the end of this 5th year, you can actually become a registered pharmacist and work independently. The degree is also a very strong degree for other studies, such as medicine. Next slide, please. What do pharmacists do? I know when I decided to be a pharmacist quite a few years ago, I just thought pharmacists worked in community pharmacies, but the scope of practice of pharmacies has really accelerated over the last 30 years. We're considered the medication experts of the healthcare system. We give advice to patients, but also to other health professionals such as doctors and nurses. We prepare and dispense medicines. There's a growing market for learning how to compound medicines and make specialist medicines for individuals. We provide advice and education to individuals about how they use their medicines in the best way. We work with other health professionals to promote positive health outcomes. We participate in public health activities such as vaccination. So at the moment, you may have seen on the news that community pharmacists are being involved in vaccinating people against COVID. And many of our students are actually assisting with many of the state-run clinics with reconstituting vaccines to be administered. And as pharmacists, we also undertake research. And the nature of the pharmacy profession means that research can be anything from clinical through to stability studies on medicines to looking at how people interact with the healthcare system. Next slide, please. So to get into pharmacy, there are some prerequisites. The ATAR last year was 78.1. And there are some prerequisites, and you need to meet each of these prerequisites. So for VCE, units 3 and 4 with a study score of at least 30 in EAL or 25 in the other English other than EAL. And with chemistry and maths, we need you to have done units 3 and 4 with at least 25 in chemistry and 25 in any mathematics. So you need to get all 3 prereqs at that level to be offered a place in the program. Even if your ATAR is well above the required ATAR, if you're couple of points short, you won't get offered a place. So it's really important that you make sure you reach those prereqs. Next slide, please. Now, it's a 4-year program, and the structure is in front of us here. So year 1, we start with your foundational sciences. Your foundational sciences prepare you to learn more about medicines and how they interact with the body in the later years. So you'll do Introduction to Pharmacy in Year 1, that's with me, and Essentials of Healthcare Practice, which looks at social accountability and the social aspects of health, as well as your physical biology, physical chemistry, biology, and maths and stats. In year 2, you start specialising into the biomedical sciences. So you start learning about what pharmacists do in Pharmacy Practice 1 and 2. You'll have your first practice experience, your will placement in Pharmacy Practice 2. You'll learn how drugs are compounded, how dosage forms work, and you'll start learning about the body in more depth. In year 3 is the year where you gain a lot of your clinical knowledge for the program. You learn how therapeutics works, how drugs are used together to actually help, so you can actually help treat diseases. You'll have more extensive courses in pharmacy practice, and you'll learn about compounding medicines in this year as well. Next slide, please. Year 4 is the year where you bring everything together. This is a with honours degree, so everyone who does this program ends up with an honours degree of various classifications. So we have 2 capstone courses, and they are Integrated Therapeutics and Pharmacy Practice 1 and 2. And those courses do advanced therapeutics. We bring in speakers from the hospital system and other experts to advance your understanding of therapeutics and the cutting edge of practice. You'll also learn how to do research. Research is a really important skill for a health professional to have, and understand how medicines get developed from the discovery of a molecule through to the product that you actually find on the shelf. In semester 2, you get an option to go one of 2 ways, and this is the only internal choice within the whole program. You either get to do a pharmacy research project, which is usually done in groups of between 3 and 5 students, and many of those projects are actually done in the hospitals in partnership with the hospitals. So the hospitals have identified areas that they want to investigate in their practice, in their hospital, and our students will actually go in and do that work and write a paper, and often these papers are published. Some of the other types of projects include stability projects, looking at systematic literature reviews, and also community-based projects. The other stream of students can either do business, they will do business skills for health professionals, and that's really important for students who may be interested in running their own business in the future, and a pharmacy services project. And the pharmacy services project sends pairs of students into community pharmacy to actually research a service that's been offered by a pharmacy and assess whether the service is acceptable to the customers, and think about ways in which the service can be strengthened. So lots of scope for interesting work there. Next slide, Nari. There are some pathways. You can Pathway A is a 5-year program. So if you miss your prerequisites, or you don't have any background in chemistry, or your mature age, you can go through the Associate Degree of Applied Science, which is a 2-year program. In your final year, you will do Healthcare Practice, Essentials of Healthcare Practice, which is a program in the pharmacy, course in the pharmacy program, and then you'll be guaranteed a place in the pharmacy degree, and you'll enter into 2nd year of the pharmacy degree and finish your degree in 5 years all up. So that's the main pathway. Also, students who are doing pharmaceutical sciences or biomedical sciences, also if they successfully get through their 1st year, have the option to apply through Apply Direct to get a direct entry into pharmacy, and that's another option you can do. Thank you. Another slide. Thank you. Okay, so what can you do as a pharmacist? That is Olivia. Olivia is a resident pharmacist at the Austin Hospital. You can work in community pharmacy. You can work in hospital pharmacy. There's the biopharmaceutical industry, clinical trials administration, drug information, medical research and communication, and even public health. We have a lot of students who are working in many of those different fields. So they'd start off in one area and they've moved, say, from community to hospital or hospital to industry. There's a wide scope of options in the profession where you can work. It's where your interest takes you. Next one. So our industry connections, we work on industry projects with real clients. As I said, we've got projects with the hospitals, we've got projects with community pharmacies. You'll do a lot of local will-based placement. That's work integrated learning. We have had an overseas work placement before COVID. For obvious reasons, that's on hold at the moment, but we will get it back as soon as it's safe, and you can do that in your 4th year. We have students entering project competitions, which are judged by leading industry experts, and a lot of mentoring from industry professionals. So there's lots of options to interact with the profession at various levels of the program. Pharmacy is a really small profession and we all know each other, and it's really important that when you come into the program you start networking and become socialised to the profession. Next slide. So how do we help you get out there and get the best possible career you can get? Our labs have the latest facilities. So you'll develop the skills of a pharmacy practitioner. We've got a purpose-built model pharmacy. We have a very strong focus in our career with communication at every level of the program, and being strong communicators helps you succeed in any workplace. We have industry advisory committees, and the industry advisory committees bring a number of experts together from all different areas of the profession, and they give us advice about our program and what we need to think about going forward. And our program is accredited. It has a full accreditation from the Australian Pharmacy Council, and that's a really important thing to know, that our work has been assessed against all the other universities and we've got full accreditation. So all of those students in those pictures are real students. They're not models, and they've all got amazing careers now. They've been out perhaps 6 or 7 years now in the profession, and they're all doing really, really well. Next slide. The other thing, being a student, studying is important, but it's really good to have an active student association, and we do have one of those, and it's called RAPS, and it's the RMIT Association of Pharmacy Students. That's their mascot, Pill the Penguin. And in Australia, there is a national accreditation system, a National Pharmacy Student Association, and RMIT RAPS is associated with that. So you get a big chance to network with other students. You get a big opportunity to interact with other students from all over Australia. There's a conference every year, a congress in January every year, and that is the highlight of the year. And there are a number of events that the 3 Victorian organisations hold together, including the Victorian Students Pharmacy Conference, which is pre-COVID, is usually April each year. So our group, RAPS, and the group from Bendigo, La Trobe, they actually get together and organise a pharmacy conference. There's lots of social and educational events run by RAPS. They contribute towards the student pharmacist agenda and current debates, and they provide an active voice on student matters. So, like Claire said, one of the great advantages of RMIT is that we know all of our students. We're extremely accessible. And I think that's one of the, for me, is one of the great joys of working at RMIT, is that we do get to know all our students, and you know, we maintain that relationship after they've graduated. Is there another slide? I don't remember. Thank you for listening. Now we're going to answer your questions. So Claire's going to come back on. And are there any questions?
All right, thank you, Catherine. There was a few in there, so I'll answer what I can. So placements throughout the program. So starting in year 1, in second semester, you will complete a 3-week placement, so clinical placement, and this continues throughout. So in second year, you'll do 2 blocks of 6 weeks. So first 6 weeks in semester 1, second block in semester 2, and this is repeated in your 3rd year. And when you take on the 4th year, you have 2 blocks, a 10 and a 12-week block, which run virtually back to back. So it's a 22-week placement in total. In terms of sourcing placements, we do all that hard work for you, and so that is not something you have to worry about yourselves. And as part of that, we aim to vary your experiences. So you're not just always at a hospital environment. You might go to a private practice and things that are different to get that overall experience, including rural placements, which are really important. I have seen a few questions about transferring from other degrees, and this is something our enrolments team will be very able to help you with. But generally, if you have done something related to the sciences, that would potentially be a pathway in, and as was pointed out, the associate degree in applied science. And if you're successful, recognition for prior learning can be gained through credits, which will help. There was a question about transferring from other streams. As you saw in the makeup of each stream that we offer, you learn those core discipline stream-related courses starting in first year. So unfortunately, you'd have to start in the first year and be credited for courses that overlap, but that material would have to be started in first year. So there's no direct transfer as such.
I might jump in and do a couple, Claire, while you have a look through. Do you find your own internships? Yes, you do. We act as a clearinghouse for people who are looking for interns. So we get a lot of emails from people who want interns, and we distribute that through our network. We have a network where we can actually send notices to the students. The hospital pharmacy internships are run through the Society of Hospital Pharmacists, and students apply to a main clearinghouse, and then they do all their interviews. So my 4th years at the moment are doing all their interviews for their hospital pharmacy jobs. To date, everyone who wants an internship has had one before graduation. So I think that's really, really important to know that our students have a really good and strong reputation in the workforce, especially around being work ready and strong communicators. That is one of the most important tools you have as a pharmacist, is how you communicate. I've got a question from DA. If we go through a pharmacy pathway, do we still need to do one of the options from year 4, semester 2? Yes, you do. So in your second semester in year 4, you need to do either the pharmacy research project in a little team, or you do the business course with the services project. So you do have to do the full 4 years of the program. There's no way you can sort of cut it short and still graduate. We have roughly this year, I teach the first year. Someone's asking about, sorry, every time I do a presentation, I get an itchy nose. Roughly 130 people in first year. Now, roughly 30 of those students will be straddling year 1 and year 2. So 130 roughly is the maximum we could sort of take and make sure that we can all get you placements in years 2, 3 and 4. So the last 3 or 4 years we've had 130. It is a popular program. There is, I still think, even though it's quite a few more students than we had when we started the program, I still think the advantage is that we actually know our students really well and we're really accessible as academics, and you don't get that at every school. Claire, would you like to jump in?
Thank you, Catherine. I'll just answer with our numbers. So typically in our medical imaging, 60 students, in radiation and therapy, 30 students, and the same for nuclear medicine, 30 students. Just there was a few queries about that. And as well as transferring from one stream into the other. So that would be dependent on your GPA, which is your grade point average, so how well you've done in the other stream, as well as availability going into the other stream. I just want to highlight what Catherine has said because I think it's a really good point. We do know our students very well, and like I said with Chelsea and her quote there, we do aim to provide that environment for your ongoing education and the sense of belonging to the program and being part of medical radiations. And I think the team, the academic team involved, are very supportive of this, and hopefully that translates and our students feel that. I think that's all I have.
Are there any other questions I need to answer? We've done how many students? I'm just working back through the list. Pharmaceutical sciences, if you don't get the ATAR to get into pharmacy, your second choice should be pharmaceutical sciences, because 6 of the 8 courses are the same as the pharmacy program, and then apply at the end of your year through the RMIT program called Apply Direct. Someone's just asked a question about what's the difference between our program and other programs. I think every program in Australia is accredited. Every program in Victoria is accredited. I think we have a really strong focus on students being ready for work and students being strong communicators, and students communication is a really important thing. You've got to know your knowledge, but if you can't communicate your knowledge, then that's a problem. So I think we throughout the program, throughout the pharmacy practice aspect of the program, we've got a lot of really authentic work-related assessments. We've got a lot of really authentic experiences. We bring in professionals to speak to you whenever we can. We are all pharmacists, apart from our one academic who is a pharmaceutical scientist, because that's what he teaches. We're all pharmacists, and we're all passionate pharmacists. And I think, you know, for me, the joy of it is the size of the cohort, the fact we get to know each other, and the fact that, you know, it's a bit different when you're a professional teaching people who are going to come into your profession. I think that's quite a special relationship we all have with our students in the health professions, because you're coming into our profession. So we take everything we do with you, everything you do, very, very seriously. I've been here 11 years. I really love it. It's the place I've been the longest in my whole career, and I think it's really important that you have that feeling of belonging to RMIT Pharmacy, because you are, the people you meet in your program are going to be your colleagues for life. I think when you're at a bigger, more impersonal university, it's very hard to make those contacts. So that's what I love about being an academic at RMIT, and I think that follows through for the students as well. Are there any other questions? Claire, Ayaz has just popped up a question for you.
Sorry, I'm just looking at it now.
Okay, I might just jump in, Claire, and there's just one question on pharmacy. How many places are reserved for the pathway option? Roughly 35. Okay, so roughly 35. If you're in the associate degree, you have a what's it called? Guaranteed place. If you're in other programs, it's based on ATAR. So roughly 35. It does vary from year to year. Basically, contact hours, I'll talk about pharmacy. It's roughly 20-ish hours a week. Once we're back to face-to-face learning, some of the stuff you're doing will be recorded, but some of the stuff like your pharmacy practice and your medical radiation practice professional courses, you need to be on campus because you need to learn how to do things. So roughly 20 hours a week. It's not always easy to predict where those 20 hours are going to fall because there's a lot of restraints in doing a timetable. But think about roughly about 20 hours a week. If you're going to become a clinical pharmacist, you don't have to do additional study. As Vivek said, Vivek has been a clinical pharmacist, but there are Masters of Clinical Pharmacy you can do once you're in that position, and they're very well regarded. We don't actually teach them ourselves, but there are advanced studies you can do. Claire, do you want to jump in and do the last one?
Thanks, Catherine. So there was a question about having chemistry. So if you have completed units 1 or 2 and 3 and 4 in chemistry, that is fine. So with the physics end, we take you through physics in our first year. So we have medical radiations physics in first semester and second semester, and really build on that foundation of understanding the physics and, importantly, the physics behind medical radiations. For pathways, for people who haven't got the ATAR that they were hoping for to get into the program, we do see this. So as I mentioned, the associate degree in applied science is one avenue, or a science related degree that someone might have started. So we do see transfers through that means as well. And I think that is all that we have.
I have a couple more. Pharmacy is only offered at Bundoora. So you need to be committed to travel there. 25% of the courses in the program are offered online, but there are some courses that you would be expected to come into for the classes. That we do have a lot of students travelling in from places like Geelong and Frankston and Bacchus Marsh. It's always good if you network among the class and work out where everyone is coming from. You can often work out ways to share transport, especially when you're in first year and perhaps not everyone has their driver's licence. The other question was about how many people apply to pharmacy at RMIT each year. Roughly 400 to 500. Each year as their first preference, and then I think if you add it up, I'm running on memory here from the VTAC stats, if you run through the rest of the preferences, probably about 900 all up have us as a preference in their program, but probably about 500 as first preference. Okay, so last chance to get a question in before we close.
All right, thank you everyone for listening, and I think we'll finish the session there. Thank you.
Thank you.